Hello, everyone. Good evening, and welcome to tonight's section on Students for Sensible Drug Policy Africa's leadership training. It's an avenue where we try to educate ourselves on drug policy, harm reduction, and human rights, and also an avenue to also train the next generation of leaders in Africa. It's really interesting to have every one of you join us tonight, and it's really going to be amazing with the line of speakers we have around. Before I go ahead, I would love to appreciate the presence of my colleague, Rosin Downs, who has really put in a lot to make sure this section comes to reality, and all our amazing speakers and our participants for finding time to attend. The first section is going to be held by our speaker from Nairobi, in person of Mrs. Bernice Akundi, who is a drug policy and human rights advocate from Kenya. Ms. Akpodi has worked as a consultant in East Africa in the areas of drug policy and harm reduction, HIV, human rights, gender and social policy for more than 15 years. Currently, she's the advisor for research and policy at Vocal Kenya. Ms. Bernice has been credited with creating and supporting national network of people who use drugs in East Africa. Previously, she was also a researcher for the African Mental Health Foundation. Ms. Akpodi holds a master's degree in sociology and a bachelor degree in psychology and communications from the University. Tonight, she's going to be contributing a lot from tonight's section. She'll be speaking on general trends in regional drug policy reform and what needs to change in Africa. So permit me to welcome Ms. Bernice Akundi to join us tonight. Welcome, Ms. Bernice. You have the floor.
Thank you, Moro. I hope you can hear me.
I can hear you.
Yes. So much. So I'm going to take the shortest time possible so that I summarize my points without wasting a lot of time. And then maybe the questions can come in later. So about drug policy reform and Africa and what we know, there's a lot of evidence in the internet and the work that we do. And it is actually documented right now that by the year 2050, Sub-Saharan Africa will have the highest number of drug users in the globe. And it is also estimated that Africa, West Africa alone, is going to have around 13 million drug users in the next 30 years. So Africa has still remained a transit hub. We are not producing or selling, we are not producing, and we are not the originators of heroin or cocaine or meth. We are just a transit hub. However, the last 10 years has seen an increase in the drug trade. We have seen an increase in the number of drug users. And we have also seen an increase in the economic stress and employment. We have seen an increase in the number of people going to jail for petty drug offenses, just like possession of drug use. We have seen prisons filling up. We have seen drug trade sponsoring political campaigns. And we are looking at a healthcare crisis, something our leaders do not want to talk about. So, in Africa, drug trade is largely seen as a social problem. A social problem is just a behavioral problem, something that we say is not medical. And that is the reason why there's a lot of confusion when it comes to monitoring and treatment. So something social is something that the ordinary person expects you. It's behavior. I mean, just change it. So what? It does not concern me. And that's the attitude that we are seeing a lot with government when it comes to monitoring and service delivery and control. So apart from socializing the drug problem, there's also the criminal aspect of it. So it is not people's problem, yet it is a criminal problem. So we have seen a lot of healthcare systems not wanting to support the drug use system because of our historical background of seeing it as a personality, a behavioral problem, and not medical concern. We do not want to give in a healthcare budget. We do not want to put in policies that support drug users. And you also see, for this reason, then you will not find insurance benefits in Africa for people to go for treatment. So these are some of the obstacles that we are finding with the drug use in Africa. So what are we saying? That governments are not putting in money in terms of treatment. Governments are not putting in money in terms of social welfare, and so we are asking ourselves, what do we want? If we are talking about drug policy reform, these are the things that we are talking about. That's just a brief background. So what do we want? We have seen a shift. In the past 10 years, there's been a shift in the global perception in the drug war. We have seen countries beginning to change. Maybe one or two in Africa, not so much yet, but we have seen a lot of shift of perception when we talk about drugs. So what we want to see is what we call decriminalization, which a lot of people still do not understand. But when we talk of decriminalization, we talk about administrative offenses, as simple as not using a seatbelt, as simple as a traffic offense. Are we able to get there? When we talk about regulation and control, is government able to control this? Is government able to regulate? For example, prescription, as simple as, getting it for prescription, as simple as government monopoly, as simple as controlled access. That is what we want to see. So when we're talking about drug policy reform, we are talking about the treatment, we are talking about the laws, we are talking about the social, we are talking about the medical. And the background that I've given is a history that has been going on for the last 50 years. When President Richard Nixon came up with the drug war, it was a psychological solution to a social problem. Because psychologically, when you make penalties harsh, then you expect people to desist from behavior. But that is not true. It is also true that psychologically, when you control something too much, the more reason why people will go for it. Just as simple as sugar in the house. When you take sugar and you control it to a small baby and you hide it, they will take the whole day planning, scheming how to get that sugar. And the moment they get it, then it becomes an achievement, as small as it may seem. So what are the key components that we want to see when we talk about the reform? We are talking about screening for drug users. We are talking about prevention. We are talking about early intervention. We are talking about treatment. We are talking about coordination. We are talking about social programs. We are talking about employment. We are talking about childcare. We are talking about follow-up and long-term monitoring. So all these are things that we want to see in policies anchored. We want to see governments coming up. We want to see civil society. We want to see families coming up to support. Because if we go by the statistics that are being shared on the internet right now, Africa and sub-Saharan Africa, we are actually facing by now a public health crisis. With the lack of employment, we are seeing a lot of young people going into drug use, into the drug trade. If you're not going to come up with solutions that are going to take care of this, if we are not going to look at drug use as a medical issue and still throw stones that this is a behavioral issue, this is something that the person needs to get out of, this is something that they should just stop doing, the way our leaders are looking at it, then we are in for a terrible, terrible crisis that we may not be able to solve. So precisely, that is the current situation. That is what we want to see, and that is where we want to go. Unfortunately, our governments right now are not keen on doing this. There's a lot of politicization when it comes to the drug war. We have seen it in Kenya, for example. We have seen the drug trade sponsoring political campaigns. We have seen politicians buying political seats with drug money. We have seen a lot of things. We have seen drug sellers walking away of prison, leaving users. We have seen the criminal justice system framing up charges against drug use. And it's crazy that whereas punitive laws are not working, the government does not have an option. So there's a lot of confusion. Like one leg wants to go in, one leg dragging behind. And that's what we are seeing in Africa, from down south to West Africa, to East Africa. So we have a problem in our hands. And precisely, that is why there's a need for a revolution. We need to relook at the way we see drug use. We need to relook at the way we look at drug users. We need a total overhaul of the drug policy that we inherited from the colonial governments, because it is not helping us. Thank you so much.
Thank you so much, Ma. It was really short and sweet, and I feel we should look at said so far. We still have 5 more minutes for your section. Questions from the audience? If you have questions to ask Miss Benis, you are free to you have the floor. Okay. Hello, Ma.
Yes?
Yeah. So we don't have a question for you.
It's okay, I'll wait. Maybe one will come in later.
Yes. So we would go to our next speaker, who is a member
here now.
Okay, we have a question. Okay, okay.
Hello. Can you hear me? Can you hear me?
Yes, go ahead.
Okay. I would like to ask, looking at all this,
you have the floor.
How can we have, you ended your statement with we need a total overhaul of policies that we inherited from our colonial masters. So how do you think Africa, looking at our social background, how do you think we can generate policies that are tailored for Africans by Africans? Thank you.
Thank you for your question. I mentioned that traditionally, Africans, we do not see drug use as a medical problem. If you look at the Diagnostic Statistical Manual of Mental Disorders, the DSM-3, the DSM-2, the DSM-4, drug use was classified as a mental disorder. And even though mental disorders was not part of the primary healthcare clinic, you cannot walk to the village to a healthcare clinic and say, I have withdrawal symptoms or I have psychosis, and you'll be treated. Your village members will probably say your ancestors are chasing up on you. And a lot of people with mental issues are called like they're a gone case, like they cannot be helped. Like it's a spiritual issue. There's no solution. But we all know that is not true. So we have had a tradition of demedicalizing mental health issues and drug use issues. And this is why the society did not create any, the government did not create any control. They did not create any early interventions. They did not create prevention measures. Look at HIV, for example. Just see how it is tailored. Just look at maternal child healthcare, for example. Look at the professionals and see how systematic, how trained they are, how good things happen. And then come and look at mental health and look at drug users now. And you go to a hospital and just say, I have psychosis, for example, from drug use. They'll probably tell you, well, here we don't treat people who are mad, because hospitals that treat people with drug use disorders, they are classified like hospitals for mad people. So we already create stigma. So now the policies that we need to answer to our situation, our environment as Africans. We need policies within the Ministry of Health that can start treating drug use as a medical issue, first and foremost. If it is treated as a medical issue, any person with the drug use disorders will be screened. First of all, it will be in a hospital. It will be funded. Right now, drug use treatment is not funded. I don't think there's a country that funds drug use treatment anywhere in Africa. It is all donor-funded money. There'll be prevention. There's what we call early intervention. Early intervention means even at the primary school level, class 8, for example, in Kenya, initiation into drug use is at 8 years. So if government already has statistics that initiation in drug use is at 8 years, what are we doing? There are no community programs. Those are early intervention programs. But do they have intervention programs for that age for HIV? Yes, they have it even when the child is unborn. They say, for you not to get HIV, these are the drugs that you need to get. But what do they do for people who use drugs? There's nothing. There's no funding. There's no training. So when we are going to have policies that are going to take care of this, we should put in all the aspects. And I'm talking about prevention. I'm talking about early intervention. I'm talking about treatment. We're talking about social. We're talking about the coordination, employment, housing, childcare, the criminal justice system, everything to be included in the policies. Because in our setting, in the Africa setting, you're not going to do drug use interventions without social welfare. You're going to find drug users in the streets. So what? They go to the OST and then they have nowhere to sleep. That is how hollow our policies are. Why? Because we copy them from the colonial masters, we do not have enough money, and we want to implement them haphazard. They are not well thought, they're not well implemented. So that is some of the challenges we're having with the current OST programs that we have. They are haphazard, they are halfway thought, they are not complete, and we do not have even an impact assessment on what is going on the ground. So right now, if you came to Kenya, for example, implementing OST, how many people have graduated from the system? Nobody knows. How many people have benefited from the system? Nobody knows. How can we tell government that it's working? Nobody knows, because nobody actually cares. But if you look at the statistics for HIV, believe you me, you'll get it from the time they started treatment. That is how bad things are in the policies that we have. I hope that answered your question. Thank you.
Thank you very much. That was so insightful and so apt. Really appreciate that section. And if you have your questions, just feel free to chat box. You can just drop your questions in. The next speaker is a member of the community, and is going to be talking about what we tend to expect from the drug users community. He's a member of African Input, and prior to this section, I've been able to follow Mr. Richard's activities across the African continent and what he has been doing with the network of people who use drugs in Africa. And I feel this section is really important because I know a lot of our members in SSDP across the continent always ask me a question that why are we promoting say no? That means KNOW and not NO. So I'm not like I try as much as possible to explain to them why we propagate no and not NO. So, and I'm sure that Mr. Richard, who is a community of people who use drugs member and a member of IDPC. IDPC is the International Drug Policy Consortium. He advocates for friendly drug policies. Being a drug user himself, he says drug use is a choice. Mechanism. He is now the coordinator for African Input across the African continent and a member of the steering committee of the upcoming ICASA 2021. Wow. For him, drug users deserve a place on the table of advocacy and in the design of drug policy. That is fantastic because we can't talk about drug policy without having people like Mr. Richard come out to tell us how people really feel, what is the reality on ground. So Mr. Richard, you are welcome and good to have you here.
So thank you very much. For me, good drug policies are those policies with a human right based approach. So basically, we as drug user we face discrimination. So the good drug policies we must have like outcomes the right to be free from discrimination and stigma. So in many societies across the region, people who use drugs are stigmatized. So according to when I'm looking to the African Charter on Human and People Rights, ratified by every African country except South Sudan, we have the right to be free from discrimination. So this is come from Article number 2 of the Charter, and also we would like to see the prohibition of torture and cruel, inhuman, and degrading treatment. For instance, you can be punished, you can be bad treated for having just only one dose of heroin, one joint of cannabis, and humiliated just for it. And there is no difference between the seller and the user. So this is also a need. Also, the right to liberty and fair trial. So those I'm talking shall be the outcome of good drug policies, and of course, and the most important is the right to health. When we are talking about drug policies, as Mrs. Apondi said, the right to health is very important. So I'm repeating what she said. How many governments are founding now treat health to drug user? How many governments are founding harm reduction services? They all accept to get fund from other donors as global fund. So basically, recommendation, I'm going to use the advocacy note from IDPC 2017. So basically, drug policy shall remove criminal penalties for drug use, possession, and for personal use. Also, instead of punishment, focus on the provision of voluntary evidence-based health and social services. So there we are talking about harm reduction. So also sanctions are to be used. They should be applied as part of a framework encouraging access to health and social services and not lead to net widening. Also, between personal use and supply should be done a difference. Better to distinguish the user and the seller. Also, good drug policies shall come with training, sensitization, and guidance to police, judges, and lawyers on drug use, harm reduction, treatment, and decriminalization. So decriminalization measures shall be followed by investment in health and social programs, because there's a question now which is being asked by everyone. And then after the methadone, what people, drug users are now after methadone, are they going to do? So we need social programs, in particular harm reduction services, to ensure maximum health outcomes. So basically, I'm stopping here. So maybe I will answer a coming question. Thanks.
Great. I think we've lost Maro just for a moment, but we have a question in the Q&A, which we'll answer live. But the question is, Africa has downplayed drug use amongst women and it's rising every year, but we don't have rehabilitation set in place and we focus more on male users than females. How can we change that?
Yeah. I see the question from Fatima. So we from women who use drugs, there's a double stigma. First of all, because they are women, and second, because they are drug users. So we have to do specific programs for women because they have many needs than men who use drugs. We have to look for the reproductive health, how to also the reintegration in the society after when they are after rehabilitation. It's most of them, when you look very carefully, you can see that they've gotten children during the drug use because they have been abused by the other drug users. So we need to focus on best program for women who use drugs, and this is also something which is very sensible, because women are at a double risk of stigma. So that's what I can say now. Yeah, thank you.
I think Maro has some connection issues. Maro, are you back?
Yes, I'm back. I am back. I'm back. Thank you. I would Rosin, can you take it up?
Yeah, of course. If anyone has any additional questions, please raise your hand or put it in the chat. Or you can use the Q&A function. I'm just going to check in case we have anyone raising their hand. Okay. Logar Abila, please. You have the ability to talk now. So if you unmute, you can ask your question.
Hey guys, how are you doing?
Hi, Luga. Hello,
yes,
Luga.
good. Nice to see some good long-time faces, Maria-Goretti, Richard, Apondi. It's nice to connect again. My question is, okay, currently we have seen a lot of stuff happening in the drug policy at the global stage. And my question is, for example, we saw the UN and the cannabis and the other states. I think there were like 9 states within the American who were able to legalize the cannabis for both personal use and medical. Now, my question is, what is the changing drug policy environment in Africa? And then what can we learn from the recent change of tunes within at the global stage? Is there something that we as Africans can say, like, if these were done at this particular stage, then what is our mandate through the African Union, through the different African blocs? What can we do to catalyze or to enhance this kind of conversation at the global stage? Because what I'm seeing, and don't quote me wrong, we have so many best literature in the world, but again, moving forward in terms of can we act or can we walk the talk? It's something that have been a challenge to us. Is it because of leadership that do not understand what we are doing? Or is it the current strategy that we are using is not working out? Because sometimes I've been even looking at the LGBT groups. For example, the movement in Kenya, they are very active, and sometimes they were able to seek court redress. Can we use those angles at the African court just to have this conversation going on? Because we will be seeing people moving at the global level, but African as a country, we are stuck. We do literature review, Dex review. We want to do this, we want to do that. But again, we are just stuck there. And I thank Richard for bringing the aspect of the human rights issues and all that stuff. Right now, we have a pandemic. Nobody's talking about it, like African and the COVID pandemic. How do we reach to that individual who is in the village who cannot access these health services? We are talking about the vaccination at the global level, while the African countries, we are still even having problem with the PPEs. So again, my question is, as comrades, what is our take? What do we learn? How do we move forward so that we be at a level whereby we get done with the desk review, with a lot of meeting, but now we act? Do we need to bring people on board, like the electorate, like the community? Do we need to do a lot of sensitization? We have the community, people who use drugs, we have them, right? But again, where is the missing link? Is it the families who are not seeing? Is it the general community who are? There's somebody who raised a question of people see us as we are promoting drug use. It is because there is a lack of knowledge somewhere. And we're talking about, we are like 21st century, we're still talking about these particular issues. People don't understand. As NGOs, as comrades, are we lacking something? Is there something that we can learn at the global level that we can do as individuals, as Africans? Yes, I know Ghana have done something. I know other countries who are trying to move forward. But as an African leadership, the Pan-African, where are we standing at the global level? We have people who want cannabis to be legalized, like for medical, for pain reliever. But people don't see the other aspect. People see like the general use, you want to mislead our people, you want to do this thing, it's for your own gain. How do we change this narrative? Thank you.
Rosie, I don't know whether I can come in to respond to some of the issues it's raised.
Sure, feel free, ma. Feel free.
Okay. Yeah, Luga, thank you very much for highlighting these issues that has been a challenge, especially in the continent, in advancing the advocacy frontiers around drug policy reform. First and foremost, I will want to acknowledge that I think civil society has done so much for the past 5 years. I say 5 years because for the past few years, it was very difficult to even see this kind of conversation even happening in the continent. It was treated more or less like a sacred thing. I mean, the mere mention of drugs was something that will not even be entertained on the table for discussion. And for us to now begin to even see this kind of space created, I believe that, of course, we have made progress, but not significantly enough to be able to see a lot of inroads in the process. Having said that, I won't say that civil society probably is doing something not right, or that is probably causing the issue. But let's look at it from this perspective. I believe that the problem in terms of the reluctance of governments to open up this space or that particular conversation to make things happen on the ground is as a result of the fact that many governments, when you work with them, I mean, civil society groups will tell you when you are working with them, they are looking out for things they can do to score some political points, or something that they think that when they undertake will bring some kind of merit in the form of some votes they will garner on, I mean, from the various constituencies to be able to win elections. And so sometimes you speak with some of these politicians and they feel that this is not a front burner issue. But I believe that over the years, civil society has been able to speak about this issue, and some governments are beginning to place this as a front burner issue to make progress. Now, having said that too, I want to say that one, if civil society wants to really win this debate, we need to ensure that the right people are the people we put on the table when it comes to discussion around drug policy reform. A lot of the time, we initiate these conversations, and a lot of the people who matter in this process are left behind. Another issue I have observed from my work on the ground has been that we need a very striking entry point when we are talking about drug policy reform in Africa. Like Bernice rightly said, you know, that mindset of thinking that when somebody takes drugs, you are branded as a demon, you are branded, you know, so we need to break that myth. That myth must be broken. And when we are able to break that myth that so long as someone takes tobacco, alcohol, it's just as the same as someone who is taking cannabis or any other substance. So we need to we need to identify that entry point. And I have always argued that I think the entry point in Africa in drug policy reform is the argument around human rights and public health discourse around this issue. They are things that I believe that governments are willing to open up and undertake steps around that. So until we do this, and because even the human rights arguments, to some extent, some governments even really do not really buy into it so deeply. But I believe that if we go on the public health tangent, we are likely to make progress. Just like the way HIV, the HIV entry point was argued from a certain perspective, it's made a lot of progress. And I believe that if we are able to do that, it will really help. And I also think that civil society must begin to also hold our leaders accountable. What are we doing at the global discussion front line? A lot of the conversation at the global level, African leaders are just missing. You go to most of these platforms where a lot of these discussions are happening, and you have our leaders not really participating actively. Look at the just ended vote, the WHO votes in Vienna. I must say that, in fact, we were so lucky we had South Africa and Morocco voting to support, because the difference in terms of 5.1% was just 2 votes, and it was just South Africa and Morocco that voted for. All the blocks of Africa voted no against all the recommendations. And you know, I have been engaging at the AU level, and it will amaze you to know that a lot of these discussions, many of our people do not really understand the issues deeply, especially when you are discussing the medical bit of cannabis. Many of the and the problem is not that we don't have the expertise to be able to appreciate that, but the people who are sent to such conversations are not the right people. And so that is creating a lot of the problems in terms of the inroads. But I will also want to acknowledge that some countries are currently doing progress, and we must appreciate that. And I believe that gradually we will be able to progressively catch up with the West. But I believe that step by step, Africa will catch up. And with the little progress we've made so far in the region, I believe within myself that it is doable and it's possible. We just have to get our steps right our entry points right and get the right people on the table, and we will make the progress.
Thank you very much, Ma. That was very insightful, and I really appreciate you. And I don't know if you have any other question.
Let me just talk to Lugard, because I know he's Kenyan. Lugard, thank you for your question. When you talk about drug policy in Africa, 3 words come to mind. It is complex, it is controversial, and it is politics. I was with Maria in Cairo when we went to talk to the AU about policies, about the AU getting involved, about the public health perspective. And my country, Lugard, which you know so well, came up with a very good paper at the AU. Maria, you remember? And the paper read something like, Kenya will not legalize cannabis, but will consider for medical research. When it went to the vote for the WHO, what did they do? Politicized. They voted no. So my experience working with policymakers who also double up as politicians, if there's no political gain in it, they will push it aside. They will push it aside. There's lack of awareness in the region. There's a lot of stigma in the area where we work. The community just look the other way, the population, and you're left in the middle to somebody who has HIV and somebody that has a drug use issue. Believe you me, they'll talk with the person with HIV and leave you there standing. And that's why we have harm reduction coming in with HIV. Why are they not treating smokers? That is discrimination. A problem is a problem. A drug use is drug use. Whether the person is injecting or smoking, forgive me, but these 2 people suffer the same consequences. So why would a government choose injecting drug users and leave alone smokers? And AU has statistics very well. Smokers in Africa are the highest in number. And the more we look the other way, the more the problem is getting bigger and bigger. Because when the person starts smoking, there's high transition that this person is also going to injecting. So what are we doing? Treating half a population? That's what we've been doing. So it's this haphazard, and then we always lack resources. Anytime there's something, Africa is always lacking resources. So we have 4 problems. We have the complexity of the problem because of the type of leaders that we have. We have the controversial because it is politicized. We live in a resource-strained environment because we always don't have money. And then there's lack of awareness. If you put those 4 points together, believe you me, we are good to go. Thank you.
Thank you very much, Mrs. Akodi. I know we have a lot of questions from our audience, but before we take up more questions, we would like to have our last speaker come online on board. Then after she's done, we can definitely answer the remaining questions we have. So for the next speaker now, we have someone who has always been at various sections, various forums, various fora of SSDP Africa, and she has always been there for us through thick and thin. And she's someone who has inspired a lot of us to continue what we are doing. I would love to invite Mrs. Maria-Goretti Ane, who is a legal practitioner in Ghana and the African consultant for International Drug Policy Consortium. She serves as the focal point for IDPC in Africa. Maria-Goretti has special interest in human rights and drug policy reforms and has been involved in high-level engagement and advocacy on drug use and the law, both locally and internationally. She is also an author of several articles, research published in the International Journals of Drug Policy on drug use and harm reduction. For the past 4 years, Maria-Goretti has been teaching on the executive course on drug policy and human rights organized by University of Ghana Law School under the sponsorship of the Open Society Foundation and Open Society Initiative for West Africa. Maria-Goretti has also contributed to several books, chapters on drug policy and harm reduction. Permits me to invite now Ms. Maria-Goretti Ane.
Thank you very much, Moronfolu, and thank you, SSDP, for having us this evening to join this important conversation. Yeah, so Moro said I work with IDPC. For the sake of those who probably might not know who IDPC is, we are a global network of civil society organization, over 200 plus of us. And basically what we do is to promote drug policy debates and encourage NGO participation in promoting drug policy based on health, human rights, and development, as my colleague Richard mentioned in his intervention. So basically, I will be focusing more on transformational leadership in terms of as advocates in the region, as people who want to see reform in the region, what are some of the things that we need to do, or what should we be focusing on in terms of our advocacy? Now, so from Bernice's conversation, she talked about the fact that we need a total overhaul of many of these colonial policies and laws that we have embraced onto, and also the need for us to move away from these laws and then look at something that addresses the needs of Africans. And it's true that, of course, these are colonial laws. Even the people who introduced us to these laws are now running away from these laws and even reforming them. But strangely, Africans are still embracing these laws and not wanting them to go. Okay, so now, that's very, very funny. If somebody introduces you to something and finally comes back to tell you that these laws are bad and we are running away from them, instead of you to also do same, you are rather embracing them. And that's the sad part for Africa. So now when we talk about transformational leadership, it's about leadership approach that causes a kind of like change in individuals and the social systems that we have. So we are looking at the ability to create valuable and positive change in society with the end goal that of developing followers and leaders who will champion and enhance the motivation and morale and performance of these kind of variety of mechanisms. Now, who are these transformational leadership when we are talking about drug policy reform generally? This cuts across a wide range of stakeholders or policy makers. So first, I will say that a transformational leader in the drug policy space include governments, because governments play a key role in terms of what we need to see on the table changing. Because in all these conversations, if we don't have governments taking the steps to change these old laws and old colonial rules and policies that we have, all that we say will come to nothing. And so, of course, governments play a key role and they must be part of this conversation and the agenda of drug policy reform in Africa. So they play a critical role here. Next on the list is civil society. We know that civil society is the mouthpiece of the grassroots. And so we play a very significant role here in terms of sending the message to the doorstep of policymakers to ensure that that happens, or that particular reform takes place. And it is for civil society to be able to package this message very well and present it nicely to governments to be able to ensure that that change. We have those who help us to form opinions around the issues. And that is a critical role they play in this whole conversation. And I remember our last workshop we organized for members in the region on communication. This came out strongly. And these are which people? Journalists and reporters, the media. They play a very critical role in the sense that they are opinion formers. And so in this whole journey, we need to ensure that they are also part of the transformational leadership role in drug policy reform. And that will mean that we either need to train them, we need to bring them on the table for this conversation and ensure that they get the message right. So that when they are sending it out or when they are packaging it out to the masses, it is well packaged and it's well delivered so that people can form opinions around the issues. You all agree with me that in Africa, there is a group that is so powerful to the extent that even they can regulate what governments do. And these are which people? Religious leaders. So religious leaders are also transformational leaders that we need to ensure that they are part of this conversation and they are also part of the narrative in terms of policy changes going forward. Last but not the least is the community and families. We know that policies that have been crafted around drugs affect a certain group of people within the community, and these are which people? People who use drugs, families that these people belong to. And so in this whole conversation, many of us have always argued that to make progress, we need to ensure that community members are speaking. Community members are telling us what they need and what they support they need from us. Over the years, many of these policies and laws have been crafted without even the involvement of people who are affected by these laws. And so it is important that as advocates, we begin to consider the active participation of community members and families in this whole conversation as we go forward in drug policy reform or in propagating the need for drug policy reform. Now, Bernice has already discussed the area that we need to begin to look at in terms of that transformation, that reform that we are looking about. And so, of course, Africa must ensure that we implement harm reduction and also look at the provision of HIV services for people who inject drugs. And we must also ensure that we protect the availability of controlled substances for medical use. And so it really saddened my heart when were put before us in Vienna and I expected that I would have seen African leaders placing the need for controlled substances for medical, because you all agree with me that in Africa, palliative care, medications for palliative care, we do not have enough to be able to address issues around pain. And yet this is an acknowledgement by a body that says that acknowledge that cannabis has some medicinal purpose for certain therapeutic purposes. And yet we have decided to move away and not appreciate this and support this progress so that we can be able to have these medicines available for people who need, who are in pain and need these medications for alleviation of their pain. Another thing that we need to also consider as Africa is we need to encourage and enhance the engagement of representation at the UN drug debates. Dennis will tell you, many colleagues who are on this platform will tell you that the participation of African leaders at the global debate is really appalling. You have very few leaders who are actively participating, and those who are even actively participating are people who do not support the progressive stance of many of these drug policy reform. So you have countries like Egypt, you have countries like Nigeria, who do not support many of these progress done, and they are rather the people who are actively participating at the global level and speaking for the continent. And so it is important that we begin to look at how, as civil society, we can encourage more participation of our people at the UN level and at the global level. Because whatever resolutions that are passed there, whatever decisions that are taken there, trickles down to the national level implementation or trickle down to the national level, and of course will have impact on the policies that we have. So it is important that we begin to encourage this and move that debate to that level where there is an involvement of our leaders, and not just an involvement of them, but addressing the needs of Africans. Because it sometimes saddens my heart to see Africans being pushed by certain powers, certain global powers, to take a certain stand to support, other than Africans looking at the problems we have back home and be able to take policy decisions that will address the needs of the people back home. Just simply because of AIDS, we want to be able to go back to such countries and look for AIDS. And so we will want to dance to their music instead of rather looking at what will help the people back home. So I think it is important that we have that in mind as leaders and as advocates, that it is important we begin to push that agenda more strongly. So what should be the transformation in itself? The transformation must be that there must be a shift from that ideological and moralistic approach to a pragmatic and a humane one, where we place people who use drugs at the center of human rights and public health. Because if you look at many of our policies in Africa, they are morally based. They are ideologically based, in the sense that we are morally judging people and using morality to craft policies, and instead of allowing science to direct a lot of the things that we do. Science, like Bennett told us, look at the projections, clearly telling us that if we do not take a step right now, there will come a time that the problem will be huge and we might not be able to control it. And so it is important we begin to look at policies from the lens of science and not morality or ideological views. And we should rather allow things in that, that says health to drive most of these policies that we push. And also, I would want to say that Africa must begin to also acknowledge and implement the UNGA's outcome document. This is a document that said a lot of progressive things that we need to begin to incorporate. As we speak, UNGA's happened in 2016. How many African countries have taken this document and have tried to even do something with it at the national level in terms of policy changes? A lot of them participated in this. There was an outcome document that was agreed at UNGAS, and yet we can't see anything happening. And so it is important that we begin to look at these beautiful documents that have been agreed globally and see how we can use these documents to ensure there is that change. Last but not the least, in terms of the areas of transformation, is that we need to adapt and reform our drug laws, which two of my colleagues have already mentioned about that. Because if we do not reform the laws, we will not be able to make a lot of progress, because the same laws are criminalizing people. The same laws are prohibiting the use of methadone and other medical substances that people need. And so until we reform the laws to allow for these things to happen, and also reform the law so that we remove criminal sanctions against people who use drugs, then we won't be able to, because the more we use criminal sanctions against these people, the more we are creating stigma around them. And so the ability for them to even open up and come out and seek help will not happen. Because how many people can walk to the hospital freely and feel comfortable to approach a health person and say that I have a drug use issue, I am having withdrawals and I need help, and that health facility will be able to do so. And I remember very well, one time the West Africa Commission on Drug paid a working visit to Liberia. And we had the opportunity to visit one of these ghettos where, I mean, it's a whole community of drug users. And we had the opportunity to interact with many of them. And a lady told me a story that, I mean, till date, it still touches my heart. I feel it so hard. Because she said that I asked her, she had just given birth and she had, I mean, it's a fresh baby. And she was living in those conditions. So I was asking her if she's been able to move out to the health facility to seek help, because this is a freshly born baby and she herself even needs to be examined. And she told me that when she was pregnant and she even went to the hospital and she sought help, the mere fact that they got to know she was somebody who uses drugs, they drove her out of the hospital. I mean, these are some of the things, and this is what the laws are doing. The criminalization is creating a certain stigma around people. And so we need to begin to look at how these laws can be reformed to make sure that people who use drugs are not criminalized. Now, what should civil society do? We play a key role in this whole process because we are the grassroots. We work with the grassroots and we are the mouthpiece of the grassroots. So what should we be doing as transformational leaders to ensure that this happens? We need to ensure that we engage more at the national level and regional and even at the international level of the issue. Civil society must begin to be proactive. The African civil society must be proactive, not just at the national level, at the regional level, and at the international. And I'm very happy that civil society within the continent are beginning to take steps to see how best they can engage at the AU level as well as the international level. And that is something I really want to recommend a lot of the civil society in the region, because we are beginning to see that it is a necessity, it is something that we need to do. We also need to gather more African-specific data. When my colleague Bernice was talking about the issue, you are asking for data about the number of female users, drug users within the country. It's not available. You are asking for data of total number of drug users within the region or within the country, and they do not have it. So I think that to make progress so much, civil society, because sometimes government is reluctant to take these steps, so civil society must take it upon itself to begin to look at more specific data on how repression is producing negative outcomes. We need to begin to look at some of these things and document them. Because when we document them, then we will be able to make progress. For instance, Nigeria did that recently through, I think, Youth Rights, and that was something really commendable. And then other civil society, where they tried to document, because there was an argument as to whether harm reduction was really needle and string program was necessary in Nigeria. Was it really something that they needed? And government had always argued that, oh, we didn't have a lot of drug users, so it was not necessary and things like that. Civil society took it upon itself and began documenting on these things. And at the end of the day, when the study was done, government was convinced. So we need to begin to do that as civil society. And I believe that when we continue to do that, we will have the data and we'll begin to tell government that you got it all wrong. This is the truth. And you must go by this data to be able to help the people on the ground. And we also need to be more effective. I mean, we have to also, as civil society, identify more effective narratives for our leaders, such as using the development agenda argument, because we cannot discuss the issue around drug policy void of the development agenda. And that is something key as civil society we need to begin to put on the table strongly with many of our governments and begin to make the argument that for us to be able to achieve these sustainable development goals, we do not have to leave people behind. People who use drugs matter in this conversation, and you cannot have a universal health coverage when a certain section of people are left behind in the conversation. You are just, I mean, I remember at ICASA last year, they said Africa free of HIV, AIDS. And I kept asking the question that, how can you have Africa free of AIDS when the people, a section of the people are not even in that conversation you are having right now? You can't achieve that. And so we need to have a holistic conversation, and that holistic conversation must have everybody on the table. On this note, I want to stop here, and then maybe as and when questions come through, then probably we can respond to them. Thank you very much.
Thank you so much, Ma. That was really mind-blowing and educative and so informative. I'm sure a lot of our participants have a lot of questions to ask, and I'll really implore everyone to please make it short as possible. We've really taken a lot of time, and we feel we can do everything in a very short while. It's late for our colleagues in the Eastern African part of Africa. It's late, very late now. So if you have questions, please feel free to ask your questions and make it short as possible. Thank you. Okay, questions, no questions, or we still have people framing their questions.
Mine is not more of a question, but it is more of a comment, just to crown what our able Maria-Goretti just took us through, which is very, very interesting, taking us back to UNGAS 2016, which I was able to participate. And I like the idea that she just penned down, like in terms of we need to be proactive, and that should be our top 3 objective. Objective 1, proactive. Objective 2, proactive. Objective 3, remember 1 and 2. Okay, having said that, and this is my take, and having worked in the public HIV programs and drug abuse for years, it has taught me several lessons. Things to do, how to do them, and even things to avoid or delay. Let's all face this fact that a sickness is a sickness. Whether it results from HIV, cancer, diabetes, accident injury, or COVID, or what we are talking about now, drugs use and the drug policy. The underlying pain and devastation to an individual, family, or community is almost the same. That's why I emphasize part of working with people who use drugs and families. It's very, very key. Maybe we are missing a point. We work with people who use drugs, but again, it's high time we need to focus on families. What is their feelings? Can we advocate with them? Can they help us in this particular journey, right? Because that feeling is almost the same. That's why we still recommend that we need to adopt or have a publication of many successful lessons and experiences that we have learned through HIV programming, through the Ebola, to help us respond to terrain to manage the drug policy issues and the human rights aspect. And yes, we have seen so many governments have adopted quite a number of HIV intervention. And even we have seen the East Africa movement and the ECOWAS, the one for Ghana and the West Africa. Those are things that we really need to learn on the success. Then again, comrade, the success of these strategies resonates. If we are talking about stigma and discrimination, yes, They can be relatively a new arena, or it have been something that have been there for the HIV and drugs policy component. And again, today, I'm sorry to say that we are still stuck with it, the stigma aspect. And stigma is a multi-headed demon which will not go away, which manifests in various shapes and forms, even within our policy makers, even at the African head. People will talk with you, they'll give you, Maria talked about the outcome UNGAS document, which the civil society had drove that agenda to our political class. But again, that thing, all those documents are just somewhere in the shelves. So again, it's the hardest thing to fight. So making drug policies and human rights issues should be everyone's business, bringing on board all sectors, not only the political class, but again, it's high time we also bring more of the fourth estate, the media. We need to have them, and even the family. So that's we must trying to address these myths and misconceptions. And once in a while, let's use the legal and policy frameworks that are amongst the tools that will remain effective. I think it's now high time maybe we use those as the last resort. That is my specific or my closing remarks that I wanted to humbly submit to these particular teams. But again, let's remember, attitude thing will always remain. The stigma and the discrimination aspect, it's going to remain with us. So again, as the world is experiencing an interplanetary revolution in a number of areas, let's know that drug policy should be one of them. Thank you, Tim.
Thank you very much, Abila, for that wonderful contribution. And thank you very much to all our special guests, our speakers, our participants, our colleagues from SSDP Global, SSDP International, OC, FEHA, all our colleagues from SSDP Africa, our partners all over the continent for attending our section. Is really appreciate. Our father, Dr. Nuruddin Hussein from the Nigerian military, we appreciate your presence also. All our colleagues from Students for Liberty, other organizations here present, we appreciate you, and all our friends who have taken their time to attend our section, we really appreciate. Special appreciation to our speakers. We appreciate you. This is going to be the last section for the year, and it's really amazing to have all of you here. And I personally have learned a lot from this section, and I would like to hand over to my colleague Rosen Downs if she has a contribution also to make. Thank you.
Thanks so much. And I'd like to thank Moro in particular for organizing this absolutely incredible session. This has been one of our most attended African leaders trainings yet, and has been, in my opinion, the best one so far, only to get better as we go along, I hope. But this was incredible. Thank you so much to our amazing speakers. Your words were so powerful and inspiring. I really appreciate it. And a special thank you to Maria-Goretti for all of the support over the years. You know, the SSDP network loves you and appreciates you hugely. And then finally, just a little note for housekeeping. I will share this link again, but for anyone who had to pay for their data to attend this session, please, you can fill out a reimbursement form to get, we will reimburse you for your expenses. Thank you so much.
Thank you.
Thank you.
Thank you so much, everyone, and do have a lovely and wonderful night, and Merry Christmas in advance and Happy New Year in advance. Do have a lovely year. See you all next time. Bye.
Bye.
Bye. Merry Christmas and a prosperous New Year.